Hello, class. In this video, we will be interviewing Dr. John Breskey. Hi.
Hi everyone.
John, can you go ahead and start by introducing yourself, your name, profession, current employment, and training, as well as any identities that you may want to share?
Okay. So my name is John Breskey. I am a PhD in public health from the University of Illinois at Chicago. I also have my master's degree in public health. Both were focused on industrial hygiene. So that area would be, I think, for health science students to consider would be the environmental and occupational health. My current position is environmental health and safety specialist for a company called Wuxi AppTech Incorporated. So we are a research laboratory that does testing for medical devices and different types of therapy devices or therapy technologies. So my primary role is in occupational health and environmental safety. So obviously that's for my title, but I work on compliance with OSHA regulations or Occupational Safety and Health Administration regulations, regulations associated with the Environmental Protection Agency. And then there's a lot of other kind of minor types of regulations for different government agencies that I come under the purview EHS. Other identities, I am a first generation college student. Yep, so went to college, grad school, and then all the way to a PhD, so that was where I'd be.
Awesome. Wow. That's a long journey and that's a lot of schooling.
Yeah, it was. It wasn't all together, but yeah, it took a while.
Awesome. Thank you for sharing that. So what do you do and why do you do that? So why are you in this field of occupational environmental health?
Sure. So what I do is from environmental health and safety, my principal interest was in biology and chemistry, especially when I went through undergraduate school. So I graduated with a biology degree. I didn't have a lot of focus on my biology degree, so I did a lot of kind of ecology, some cell biology. Kind of got through college without ever taking an anatomy class. So I was a little when I left undergrad, and I started working for the chemical industry. And one of the things that I worked for a couple of different companies, and basically my second job out of college, I was working for a very small company that didn't have a lot of resources, and they were family owned, but they were working with some relatively dangerous chemicals. They had a facility in a residential area. And I was doing quality control for them. So quality control is basically a lot of simple chemistry, just trying to test that the product is meeting specifications for customers. And during that time, there was one incident that really got me into health and safety, and it was with the quality, I also had a little bit of research tasks. And my boss at one day asked a colleague and I to do a procedure with a pretty volatile naphthalene. So it's would be like mothballs. If you ever smelled mothballs, that kind of distinct odor, that's naphthalene. And so usually naphthalene is not all of that dangerous, but in high concentrations in closed spaces, it can be basically toxic, I'll put it that way. My colleague and I, as we were working with this, we started to have this strange reaction where we both felt like we were drunk. So we were getting kind of narcotic effects from basically breathing too much of this naphthalene product. It took me a day to basically realize what had happened. And when I went back to my boss about it, I said, this wasn't really a good idea for us to do that. And he turned to us, he's like, yeah, of course it wasn't. What are you, stupid? You're not supposed to do that. And that really hit me. That was one of those just kind of aha moments, like, hey, there's got to be somebody who can actually help in these situations, not just kind of expect, people to exactly know what they're going to be exposed to. So that's where my kind of interest in industrial hygiene got started. So from that, I started to read a little bit online, researching the profession. I worked for that company even for a while longer, but I got into the health and safety. I offered myself up as a health and safety officer. And
Mm,
through that experience, I started realizing I wanted to go back to grad school. And when I went back to grad school for industrial hygiene, that's where my kind of career switched to kind of research and academics. So I think that kind of answered the question, why do I do what I do? It started from where I was working and kind of realizing that there are people that get exposed to things or asked to do things at work when they don't really know what's involved with that, or at least the hazards that are posed, the risks that are posed. I've really figured out that I like working on that. It kind of takes my background in biology and chemistry together. So now I apply those types of principles to my current job, where I am the health and safety officer for a laboratory company. And so, folks or technicians or even managers or researchers will come and ask questions like, hey, we're about to do this experiment with whatever chemical or whatever biological agent. How can we try to protect ourselves? And I've got answers for them and help them work through that. So I think that answered your question all the way.
yeah, that's awesome. I mean, I think a lot of times folks might expect or assume that their employer cares about them and will protect them, but sometimes the employer themselves doesn't know, or maybe for whatever reason they just don't invest in their workers' safety. And so it's very helpful to know that there's a whole field of folks trying to protect the health of workers through environmental and occupational safety, health and safety.
Absolutely. No, I think that's a great point in terms of, I would say, in my experience, generally people want to protect other people, but there is a lack of understanding or a little bit of knowledge on what is the right way to go about things. So hiring or consulting with somebody like myself is, the right way to go.
Awesome. So you did mention a little bit about your career path thus far with where you went to school and your first job. Can you share a little bit more of what your career path has been?
Yeah, so I went back to grad school. I started doing a lot of research around welding fumes. So my master's degree and my PhD were in a very specific area of characterizing the fume, so the particles, the chemicals that are developed when you weld on stainless steel. Like sometimes when you get in that research, it gets so specific. But that was very interesting to me. And actually what kind of sparked my interest in that was the development of nanomaterials. So I don't know if folks have heard of nanomaterials, but basically it's technology using very, very small products, chemicals, whatever you want to call it. And so it's pretty novel, and we're not completely sure of the risks posed by this new type of technology. But it actually really drove my research interest in airborne particle exposure. So I did a lot of work in grad school on that. And so through grad school, I started doing a lot of teaching also. So that was kind of, in grad school, you always have, you're taking your courses, you're doing your research, but you also have to live. So the way I made money during grad school was to start teaching courses. So I taught a lot of different things. So I taught for the university itself, so doing kind of intro classes for graduate students. But then I also started doing kind of worker training. So working general contractors or subcontractors. There was a few regulations that came out about lead paint innovations. So I got involved with teaching those kinds of workers about regulations and ways to protect themselves. And so that actually drove me into realizing that I also did like to teach. So after grad school, I started working actually at Cal State Fullerton. So I was an assistant professor at Cal State Fullerton for 5 years. I was mainly the occupational health person. Now I believe Matt DeRozier teaches that class. So all of your students take the 461 course with Matt DeRozier. He's fantastic. But I used to teach that course. And then I left California for kind of family reasons. And I started working at the University of Wisconsin, doing basically the same type of teaching, but it wasn't as much in a health department. It was more in a business department. So with that business department, I was finding an urge, or at least I started finding that I wasn't helping people the way I thought I could be helping people. So that's what I started to look for, a position where I can actually start working with folks. And that's what led to my current role at the Wuxi AppTech.
Awesome. Thanks for taking us on that journey. I think it's really helpful to hear, like, what are some of the realities of going to grad school? Like, how do you make ends meet when you're in grad school? And how does that open up new opportunities to explore things that maybe you didn't think that you might be interested in, like teaching? But then also, you know, being a teacher in one place isn't necessarily going to feel the same as being a teacher somewhere else.
Yeah, no, very good. But, no, I think it's a really good point about grad school. And I think your students, so students in this class are in, they're maybe, it's like a 200 level. So this is like sophomore, junior year. Yeah, so if you are starting to think about grad school, the one other point I would put about grad school is, like, when I was in grad school studying welding fume, I did get to the point where I'm going to probably study welding fume for the rest of my life. And that's not true. Like, what you go to grad school for, like, you learn a lot in grad school and you learn something very specifically, but you're going to be applying what you learn in many different ways. So anyway, I know that's sometimes grad students get really caught up with what they're working on, but that changes from undergrad. Like, you'll kind of expand your horizons, and if you do go to grad school, you'll expand your horizons even more. So
yeah, just always being open to change and adapt to the opportunities.
Absolutely.
All right, so focusing more on your career, you did kind of talk about this, but can you share a little bit more of what area of public health you're in? So a little bit more of environmental.
Sure. So we think about it, I guess most like schools of public health or public health departments, like, so actually health science has changed. It's not health science, it's public health science.
It's called the Department of Public Health, but the classes are still health science for now.
Okay, right. So public health, right. So from the public health field, usually you kind of break it into the big groups of epidemiology and biostatistics and health administration, or sometimes even community health. And then the one other one is the environmental and occupational health sciences. And so that's my title is EHS, so environmental health and safety. So that was my focus. That's kind of where I have. And I would point out that environmental and occupational are also two very different types of fields. So environmental health would be much more concerned about the effect of environmental hazards on populations, so air pollution, water pollution, definitely food-related, I wouldn't call it pollution, foodborne illnesses would fall under environmental health. And so I know at CSUF we have a good program of getting interns at the health department in Orange counties, right? And so they do a lot of work with the kind of food inspections and stuff like that. So environmental is, so from my field, I would consider it more of an occupational health. So industrial hygiene is a field where basically you're measuring exposures to workers. So my primary focus, or at least my passion, would be related to occupational health and people who are working for someone else, right? That's kind of where I'm at for it. We typically, work to live. We don't live to work. So, I come from a point of view that, folks who go to work need to protect themselves to do the stuff they really want to do with their life, right? Their family, their friends, everything that goes on beyond work. So that's where I come. So industrial hygiene really thinks about when people have been exposed at work to whatever hazard it is. It can be an airborne hazard, chemical hazard. It could be even, physical types of hazards. So heat or noise or things like that. And then the thing is that you use a lot of the same principles, right? So that's kind of usually why environmental and occupational kind of get lumped together, is that the exposure. So, chemical hazards in the environment are going to be the same types of chemical hazards you have in your occupation. However, there's some differences in the population, right? So environmental, usually you're worried about people who are kind of a sensitive subpopulation. So usually elderly or children or immunocompromised people. Whereas a working population, if you think about it, usually a very healthy population, right? To work, to be relatively healthy, to be able to do the physical activity that is required by jobs. So that you kind of characterize your risks differently, but fundamentally all the hazards are basically the same. So that's kind of the approach we take. EOHS all the way. Dr. Kim, who else? You also have another environmental professor now.
Yeah, Phil Gedalanga.
I've never met him, but my old colleagues speak very highly of him. So take all the EOHS courses.
Awesome. Yes, plug for the public health department and the focus. That is actually one of the foci of the other program, right?
Yeah.
Cool. So now that you've shared a little bit about what your field is, what do you think is the best part of being in environmental health and safety?
Honestly, to me, the best part of it is you get to see a lot of different things. So this is kind of a silly way to kind of give an analogy. I don't know, but so in my job, we have, so it's a research laboratory, so we have controlled access to all the different laboratories, everything like that. But my badge, I can get anywhere. I can go see everything. And that's intentionally so that because I get to work with everybody. So, in my job right now, I get to work with the microbiologists, the histologists, lots of different people, right? So across the board. And that's true even in the field too. So, before I came to where I'm at now, in California or even Wisconsin, I would get to work with lots of different folks, right? So I would be working with general contractors who are demoing a building, and they're thinking about how to prevent themselves from getting sick from the lead, but also bringing lead home to their families. I was doing work with, nail salon, so the California Healthy Nail Salon Collaborative, that occupational cohort of, nail technicians who have lots of chemical exposure, lots of ergonomic issues associated with that. So that's, another working population you get to learn about. I did research where we had to learn how to paint nails. I had a grad student doing manicures to, giving manicures to little dummies. It's fun. And then, so, the other thing is kind of in the environmental side, going out to communities and start talking with people who are, maybe exposed to a pollution source out in the community. So that aspect of the job I really have always really enjoyed, being able to get exposed to a lot of different things. So nothing is ever truly kind of mundane, right? Routine. That's a lot. You by the principles, but you're getting a new situation.
Yeah. And I think it's important to point out is that even if it is one particular aspect of public health, it could be applied to anything, right?
Absolutely. Yeah, no. And that's so, one of one of my mentors in grad school, she posed it to us this way: is why? How did she pose it? It was kind of, why do we do what we do? And basically, the response was, at least this response that stuck with me, is that everybody works in some form or another, right? So students you're working, like doing a job. To have a livelihood, you have to work. And so just really thinking about how people do their jobs, you get to, kind of interact with how people are doing their job. It's fun.
Yeah, that's a great way to put it. Because sometimes folks think, oh, well, I want to work with children, or I want to work with older adults, right? Like, you are working with the working population, right? And so that could be all kinds of different people.
Yeah, everybody works, right? And every job has, even, we can kind of characterize like high risk jobs. So like working at a steel mill or working like on a construction site versus what you might consider a low risk job, childcare, or even kind of, I wouldn't actually consider healthcare as a low risk job. There's actually a lot of risks. But yeah, and even office work, there is work to be done at those types of facilities too, right? And everybody can benefit from somebody from public health, especially in environmental and occupational.
Yeah, definitely. So that was the best part. What about the most challenging part?
So the most challenging part, at least that, and I think this kind of goes across a lot of different public health, is, a lot of what I do, or at least I help people do, is to think about their risk, right? So, I can easily identify a hazard, and I say, that chemical is toxic, right? And if you use that chemical in a way that exposes you, you have a risk. You have a more likelihood of getting sick, right? That's super easy for me to say, and I think that's like the same as if you were to say, eating fatty foods and not exercising is going to increase your risk for all kinds of, heart disease and obesity and everything like that, right? So it's really actually getting people to take the concept of like that hazard and that risk and applying it to themselves, like to actually take the initiative and change their behavior to actually do it. I think that's, it's really hard to get people or to help people change their behavior or see contextualize the risks that, well, at least, obviously risk is subjective, but, from a subjective point of risk, to help people kind of contextualize it to the same, like what I feel would be sufficient for them or help them. I think that becomes somewhat difficult. So it's kind of a lot of people skills, a lot of, you have to build relationships with people. And that's like building relationships with people isn't always hard, but sometimes it can be, especially if it's with somebody who's not interested in what you have to say. They're coming across it a couple of times where, I'll come across a researcher who is doing an assay with so specifically in my job right now, we have some biological agents, and the kind of common retort to me coming in and asking about characterization of what risk is, I've been doing this for 25 years, never had a problem. Why would I need to do this now? It's like, because it's a risk, and to actually try to mitigate your risks or lower your risk to something that's acceptable for the organization, you're going to have to work on it. So it's coming across somebody who doesn't want to listen. That's hard.
Yeah, definitely. And people have different values. So how do you convince them that, protecting their safety in this particular way is aligned with that value that they have, right? Like if they're just like, oh, well, I just need to get my work done, and you're like preventing me from getting my work done. Right.
Mm-hmm.
Yeah,
Right.
I encounter a lot of pushback there.
Yeah. And so it becomes an we talk a lot about this in occupational health is safety culture, right? And so it's culture is a lot of different ways. And one thing that's interesting about I think occupational is like usually when you apply it to an organization, right? Because nobody well, you can work for yourself, right? But if you're working for yourself, you have your own personal safety culture. Usually, I'm working with people who are, or I help people who are working for someone else, right? So that's kind of the employee dynamic. But building a culture, right? So helping an organization understand what its safety culture is, and working on ways to try to change that. And it's no easy task.
On that note of culture,
Mm-hmm.
as a professional, how have you seen how culture can be so many things, right? A
Sure.
work site or ethnic or religious or whatever, and language influence the care and services in your field?
That's actually a really interesting question. Um, I think, sorry, I'm dawdling on this answer, but I would say that culture, I think from the profession, like as so, I'm involved with a couple of different professional organizations. So American Society of Safety Professionals, industrial hygienists, a couple of different ones, and we talk about build culture. Um, a safety culture that's conducive to characterizing risks and then kind of definitely building or helping others out, or at least helping others try to help themselves. Sometimes I feel that gets a little sanitized from what would be maybe different or kind of more social determinants of culture or social aspects of culture. So I'm not sure that our profession or kind of my profession embraces that difference of culture as a factor that might relate to safety. But that's not always true. I think there are definitely instances where we can use sometimes, or at least we try to use some of the cultural differences to advantage. And I'll give one example. When I was working in sort of UIC, we did a small project for day laborers, right? So day laborers are, well, there's a lot of different origins of day laborers, but basically in Chicago, the population that we were looking at were men mostly that would come to basically a home center and try to get picked up by a contractor at the beginning of the day and then taken to a job site, maybe get paid at the end of the day. And so one of the goals of that work was to actually basically just kind of pass along very basic information about health and safety, basic civil rights related to the work that they're performing, and then also getting some resources to their community. And so we found that it was kind of I was involved with the research, but I wasn't the head researcher, but the group started to realize that kind of putting in, or at least kind of going to those sites, going right up to those men didn't actually work to get any information disseminated. Like once in a while, you might get somebody to take a pamphlet or a respirator or something like that. But it was actually kind of going more into the community setting, so into church groups, and then also into health clinics where wives, daughters were, and actually disseminating information to that population that could then bring it back to the men that were actually working. So it's kind of long-winded way about thinking about culture, or at least different ways of thinking about culture from occupational health and safety. I think that from kind of that social justice aspect, or at least kind of social types of culture, prevention is working in a very small subset of kind of occupational health. And it is, I don't know necessarily if it's a deficiency, but it's not something that we bring together, at least kind of more forward to, say, a corporate type of environment where they're going to want to basically sanitize and not talk about or not kind of delve into the issue of like what culture might actually mean for health and safety. So yeah, I don't know. Like I said, it was kind of it took me a while to answer that one. But that was kind of, yeah, just my interpretation of that one.
Yeah, no, that makes sense. I mean, I think it illustrates that there are different approaches that you'll need to take, regardless of who the population is. Like, what is the best method to get the information across, right? And sometimes you're going to have to vary that depending on who the people are.
Yeah. No, and that's yeah, it's interesting because it is a different type of profession in that, you know, you start working for a company, right? So, or an organization that has mainly their motivation to make money, right? And the idea of sometimes those kind of social conversations, I'll put it that way, kind of like the social conversation is excluded from business conversations. And that's, I mean, I personally, I think it's not necessarily the best approach of thinking things, and actually start thinking about like the greater context that, you know, they actually are working in. But yeah, it's one of those places that I feel like there's probably room for improvement.
Yeah. I think that makes a lot of sense. I think we have a couple of folks in this class who are interested in the business field as well. So I think it's interesting to see how, even from a business perspective, right, you will need to think about health as far as like the health of your workers, and, you know, even if it's not coming from an altruistic perspective, like it might cost you money if you get sued someday, right?
Yeah, no, I mean, that's so, that is actually one of the easiest cases to make for health and safety, at least for me to make to executives, because now it's kind of, anyway, it's crazy. I've come from academia, but now I'm in meetings with executives. And, you know, they're worried about their bottom line, right? They're worried about their quarterly numbers. And so usually what I have to talk to them about is, you know, you've had so many injuries, so many incidents, you know, it's going to be a lot harder for you to make your quarterly numbers if your people aren't at work doing their job. So there's definitely a cross between occupational health and business. And that is another part that we talk about in our classes, try to make that business case.
Awesome. All right, so a closing question is, what advice would you give undergrad students who are interested in your field?
Get involved with, I'm going to plug again, the ASSP group on campus. They have a very robust group on campus. I just saw an Instagram post from last week. Dr. Kim was there. I think he's the faculty advisor. They have environmental health and safety office on campus. That group has internships, and then I think every intern that is in that office gets to be a member of ASSP. From a Cal State Fullerton perspective, that's what you can do to get into the field. I think kind of if that's not, occupational side is not as interesting and maybe more environmental. There are environmental courses to do, but then there's also a lot of groups around that are doing environmental work. And so I'm going to give a plug to folks at Asian Pacific Islander Forward Movement, right? They have been doing an environmental justice project for the last, it's been a while now. They're probably 6 or 7 years with it. They have some grant money that they've been working on environmental monitoring and kind of the cross section with communities and community health. I think that's a good way to get into it. Other than that, it's also I would say start looking at some of the government agencies related to that. And so I can only imagine in telling a sophomore to go look at the OSHA website or the EPA website, probably your eyes are going to gloss over. I can understand that, but both of those websites actually have very, very good information about health topics, so occupational health topics and environmental topics. And it's just a good place to get a little bit more information about the breadth of the field. And so, once you do that, there's always kind of coming back to your professor. So Dr. Kim, Mr. DeRocher, who teaches occupational health course, or me, I'll put my email in there. You can feel free to email me more about it as well. But yeah, getting yourself connected to somebody who has worked in the field, be that through that student group. That student group's great because it'll get connected with a lot of people who are already in the field. And people who are in the field like to talk to students. Yeah, that's, I think, the best way to try to figure out, if that's really for you. And so as, my time at Cal State, we started that club, and then we've had a few students come through that group specifically getting into the field. One of my first students, actually, like in my very first class I ever taught at Cal State, I had a student who was taking it was an air pollution class, and she had never taken any kind of environmental class, and she basically took class because she didn't really want to be in the class, but she didn't have any other open options. So she's like, oh, new professor, new course, okay, whatever. She now works for a company, so she does the health and safety audits for all of the sports, the major sports arenas across the country.
Wow.
So I follow her, like friends with her on Instagram, and so she's like in Vegas, in DC, in Boston, looking at all these sports venues. So, and I'll totally take the credit for her success because she like reached out to me and talked to me and came to talk to me after class and during those events. So, those are the types of relationships, building those relationships that really push you forward into the field. Because, I mean, it's really trite to say, but it's not what you know, it's who you know, and building those relationships is super important for that.
Yeah, and I think kind of tying it back to what you shared earlier about your identity as a first-generation college student, right? Sometimes, like, the thought of talking to a professor is really intimidating. So you might not want to go to office hours or, get involved in some of those things. But that's a wonderful example that you shared of someone who just took a class and then got really excited about the content and now like has a whole career out of it. So
yeah, no, I'd be honest, I'm jealous of her job. Her job looks awesome. Like, travels the country and goes to all these different games. She was at Milwaukee. She's everywhere. Yeah, no, yeah. Talk to your professors. It's surprising what they know and they don't fight. We like having students in our office.
Yeah, awesome. Well, thank you very much for
You're welcome. Thank you for having me. I enjoyed it very much, and good luck to all your students with the rest of the semester and the rest of the public health courses.
Thank you.